Hey, loves, thank you for joining us on another episode of Real Talk, where I get to have real life, raw conversations with incredible people from my circles and communities. Today, my incredible guest is Dr. Shyama Mathews. Dr. Shyama is a board certified OBGYN, minimally invasive gynecological surgeon, and NAMS certified menopause specialist. As both a mother and wife herself, her goal is to help women of all ages maintain their own quality of life while keeping up with the day to day needs of their families and careers. Her practice emphasizes the importance of patient education and empowerment to make the best possible decisions for themselves and their bodies. Her area of expertise includes endometriosis, fibroids, chronic pelvic pain, polycystic ovary syndrome, and premenstrual dysphoric disorder. Please help me welcome Dr. Shyama to our show today.
Thank you, Grace. It's
You're
nice to
welcome.
be here.
Thank you for joining us. I know you're very busy, you have a full schedule, and so I appreciate you taking the time to be with us. I'm grateful to you.
No, this is great. I love being able to educate and talk and kind of have an open forum.
I appreciate it. And the subject, I mean, you're a menopause specialist.
Hmm.
And sometimes I feel like menopause is such a bad and dirty word.
Yeah, absolutely.
And I remember, when I was in my 40s, I would hear all these nightmare story, or even before 40, like when I was turned 40, I was determined that I was going to make an effort to be in the best possible health because of the horror stories I heard about menopause, like that I would go crazy, that my body would just deteriorate. And in my 40s, I really made an effort to move into my best optimal health, but it wasn't easy because the struggle around hormones is real. Like from based on my experience, the struggle is real. Help.
Absolutely. I
Yeah,
feel
help.
I feel like a lot of women are in that position. I either feel that there's the group of women that know what's coming for them and are, petrified and exactly that, like, what can I do? What are the things that, how do I like stave this off? And you approached it correctly, actually, like being in your optimal health in your 40s, going into your 40s and approaching it that way probably is the best way to be prepared. But then I also meet a ton of women who have no idea what to expect. They haven't heard any stories. They're, women in their networks don't really talk about it. It's sort of like you said, a dirty word. It's shunned. It's sort of, shameful. It's quiet. So a lot of women also bear the burden of menopause in silence, which is also really difficult.
Yeah.
And so for me, the best way to be prepared is to know what's coming, and how to counteract some of those changes or how to navigate some of those changes. It doesn't necessarily mean we can reverse or stop them, but we can be prepared for them. We can counteract them with, whether it's lifestyle changes or medications or hormone therapy, whatever it might be, but that we have options and that we don't just have to, really kind of struggle and bear it.
I appreciate that you communicated that we have options. Excuse me. Because so many of us feel like there aren't any options. However, when I started researching and studying, I realized that there were options. And the other piece I was confused with was perimenopause versus menopause. Is that something that you could speak to?
Sure. So menopause is once you've completed one full year without a period. That's what we call by definition menopause. Perimenopause is the time leading up to that, and it might be anywhere from 5 to 7 years. It's when our hormones start to fluctuate. For some women, that presents as starting to have menstrual irregularities. Their periods are sort of skipping or prolonged or heavy or changing in their normal format. And then for other women, it'll be things like hot flashes, night sweats, sleep disturbances, mood changes, libido changes, etc. So all of these things kind of compile to be perimenopause. It's a bit amorphous, but it's that time leading up to. So I tell patients that anywhere near, your early to mid 40s, you might start noticing some of these things, and that's probably what it means.
So, Dr. Shyama, we're not crazy.
No, you're not crazy. I
Thank
have
you.
so many women who come in being like, oh my God, I feel like I'm going crazy. Like, this is happening to my body. This is happening to my mind. Like, what is going on? And almost all the time, I can confidently say, I think this is perimenopause. Welcome. Like, this is where we are now.
And it took me a moment because I really thought I was losing my mind, and I was in perimenopause, I think, for at least 8 years, and I really did think I was crazy. And I want thank you so much for validating, like, we're not crazy. It is a fluctuation in hormones. However, there definitely are things that we can do to help us step into our optimal health in that time. Can you share a few of the things that we can do to help us move into optimal health during, this new season of life?
Sure. So, one of the things I think that many women struggle with, and it becomes incredibly burdensome, is there is a change in metabolism that happens during
Mhm.
that time, right? Our metabolism slows down. What our body needs to function changes. So,
Mhm.
there really is a time where you need to reevaluate and adjust what you're doing from a health perspective. Absolutely. You're more sensitive to inflammation and inflammatory whatever it might be. It could be food, it could be stress, it could be, whatever it is that you're introducing into your life that could be throwing things off of balance. So, really being kind of mindful of that and preparing for that, how you could optimize your diet, how can you get in more physical activity and not just cardio. I often tell women do strength training because it helps boost the metabolism and strengthen your bones. So there are things that we could be doing differently during that phase that helps prepare us, and particularly that metabolism change. There's lots of information that says that women who are, kind of mindful of that and make those kinds of changes also experience less intense hot flashes,
Mhm.
and that also experience more sort of even keel with their mood. Not everyone. Other people, even though they've done the best they can still experience those things. But
Yeah.
absolutely, some changes with how you even function around sleep. Do you have good sleep habits? Are you scrolling through your phone for an hour before bed? Like these different things that you have to be a little bit more mindful and present with. I think that's kind of the biggest thing.
Yes, I agree because I've tried so many different things, and uh, being mindful has been the greatest support of my journey. Watching, what I eat, although I felt like I've always watched what I eat, and I used to really make fun of, don't eat gluten, don't eat sugar. And then once I began to adopt it, I realized, yeah, because I'm older, my body's responding differently
Yeah.
to these, to gluten, to sugar, and it would inflame me. And, again, like I'd be that, but that's so ridiculous. We could eat whatever you want, and we can. However, I noticed the difference.
Yeah.
And you're not kidding about the metabolism. Again, these things I used to make fun of, like, "Oh, but that's not true. If we just watch what we eat and we exercise enough, this is not gonna happen." Well, it does happen. I mean, you
Yeah.
know, and
I
so
explained it to women many times that, like, for a long time, we're able to kind of cheat and get away with it. Like, our body will
right,
sort of auto-correct, right? We can go on that cruise, on that vacation, and we'll come back and tighten things a little bit, and everything will come back together. We'll get back to that, sort of ideal weight quite easily. We don't get to cheat anymore. That's kind of what it is. We don't lose that wiggle. We lose that wiggle room. So we really do have to stay on track and be mindful and on top of things.
right, and so I've learned it's a lifestyle shift. Now, can we enjoy things here and there? Can
Yeah,
we? Okay.
absolutely. Absolutely.
I'm like, "Please say yes."
Yeah, absolutely. And you should be able to. And again, it's not, you don't have to suddenly switch to like a military lifestyle where you're like, real strict about everything you eat and timing and everything. But like, you have to know it is a lifestyle change. You kind of have to, be prepared for it from that perspective. But again, we can do our best, and that's one of the best ways to be prepared for it and to kind of face it with like, okay, this is what I'm going to do. But everything else is still a little bit out of our control, right? The hormone fluctuations happen regardless. We are going to end up in menopausal levels of hormone, and our bodies may still struggle with that change, and then that's where we need to turn to other resources and talk to our providers.
Yeah, I mean, I've definitely had to make a big lifestyle change. And I appreciate it, but I also appreciate the fact, I mean, I'm still living life, but I also appreciate the fact that I lived so much life before this with, the delicious foods. Not that we still can't have delicious food, but there's different, like when I was in my 30s and 40s, it was just like gluttonous and the martinis and the delicious dinners all the time. And so
Yeah.
I'm grateful that I had those experiences. Not that I can't, but in reality, no, not like I was like several times a week. that can't be part of my lifestyle, and I've come to grips with that, which is okay because I do feel much better.
Right. Right. Yeah. And I think that becomes self-fulfilling. You're right. You do feel better when you start to pay
You
attention.
do. And we can still enjoy, I mean, we can still enjoy, I'm sure, alcohol. We can still enjoy delicious foods. It's just for me, I've just been much more mindful. So we
Absolutely.
can still live, right?
Yeah, absolutely. Life does not end with menopause. Actually, for some
No,
of you, it's just starting.
exactly. And that's how I feel. So that's what I want to, it's just starting. And if we have these tools and resources and education and understanding to know that it's not over, because I've heard so many women say that it's over, I'm old, and I don't feel that way. Do you feel that way?
So many women come with that uh, basis, like with that's their sort of understanding that that's when things are supposed to stop, that they're not supposed to feel like sexual beings anymore. They're not supposed to feel like, that their bodies are functioning anymore, that they're sort of kind of resigned to it. And you have to kind of change that mindset with them and kind of be like, no, you know what? We're living longer. The majority of women that end up in their 50s, going through menopause, they're not done with their lives. They're in the kind of the prime of their careers, and they're really like, striving for things in their life, and they've got years, decades ahead of them. So it's not
Yes.
the end of anything. Consider it the midpoint if you live well, right?
Yes.
So,
I
so
think 50 is the new 30.
100%.
So, well, you touched on something. When we get to menopause, I mean, definitely with the fluctuation in hormones, our libido changes.
Mhm.
So, is there something that we can do to help ignite our, desire when that libido changes? And is it an emotional, mental, and physical, or is it all of those things that changes the way we're
So
feeling in our
libido for
body?
women is pretty complicated, because you're right, it is all of those things. There's a mental component, psychological, there's a physical component to it. So all of those things have to sort of align. And so initially when I'm talking to someone about that, it's kind of determining, all right, where do we need to focus on? So with the menopause changes, with the loss of estrogen, the vaginal mucosa and the vulvar tissue, et cetera, the tissue changes, the sensitivity changes, the thickness of the cell layers change, the ability to provide lubrication changes. So that makes that tissue a lot more sensitive and a lot more easily injured and drier. Sex can become more painful. So the physical changes that happen can sometimes lead to this cascade of other changes in our minds about, pleasure and about intimacy, because we are having those physical things happening. So there's that one aspect of it that you have to kind of visit. Where is it starting? So if it is because of that, because our bodies, we don't want to do things that are going to hurt or be uncomfortable, right? If sex is not tied to pleasure and enjoying it, you're not going to
Mhm.
want to do that. You won't have libido for that,
Right.
right? So you got to
Physically,
start with that correction.
or emotionally.
What's that?
Physic Physically or emotionally.
Exactly. Right. So like you're not going to want to mentally, you can't get to that place, and then your body doesn't respond either, right? So
Mhm.
you have to correct that physical change first. And so that's where I start with talking about what's going on down there. Is it painful? Is it dry? Like what can we do there? And then you're right, there are those other kind of mental, psychological challenges of, if we're stressed, if we're dealing with a laundry list of things in our life, like that's not a priority at the time. So you have to figure out, how do we create that as a priority? How do we, set time aside for it? How do we feel in our own bodies, right? So
Mhm.
how much of our self-esteem and self-image plays into it as well. So it's pretty complicated for sure.
And that's what was a question that I wanted to ask is, how does confidence play into this season of life and our relationships when it comes to intimacy?
Absolutely. It's important because, again, you have to think of yourself as a sexual being. And it's very hard to do that if you're not happy with what the changes that are happening to your body, if you feel
Mhm.
like they're out of your control.
Mhm.
So that's part of it too. Like, how can we help re-engage, our health and our lifestyle changes, whatever that we need to do. How can we, and sometimes it's about creating time and space for it, right? Like sometimes it is about taking that time to, feel like, yeah, I'm gonna celebrate myself. I'm going to do something special for myself so that I can kind of re-engage that.
And so you're so, you're a mother, you're a dedicated surgeon, you run your practice. So there's so many different priorities in our lives as women. I mean, how do we make space? Like, where is the space?
So part of it, like I said, so when you work on the physical part of it, that in and of itself, right? The fact that you're finding someone that you can talk to about this and taking it seriously, like, even bringing the conversation of like intimacy and, sexual function into the conversation with a provider, like a medical provider, that in of itself is the first step to take. And that's you putting yourself first, right? Because you're not doing that for anybody else. You got to do that for yourself. So
Right.
that's one. And then again, what can you do about your metabolism and your energy levels and your mood? Is that being affected potentially? Like all of these things are potentially related to this underlying hormone shift. So is there area or room to improve in that level? Are there medications, there are supplements that could be taken from that perspective to feel, again, a little bit more ownership, a little more control over it. And then that too can help you re-engage. And sometimes it's about creating time and space, like I said. So is it date nights? Is it like, let's get away. Let's get away from that laundry list of things that we need to do day to day to make our house and our life and our career run. Let's just really take a break from it all. And, again, pay attention to ourselves.
And so, like you said, like you were talking about, there are normal shifts that happen in our relationships during menopause. What if the relationship is putting, that strain, and we feel like we don't have anyone to talk to? Where's something that we can do to start with ourselves?
So, well, it very much, many of the time there is that strain, because particularly in one, either if you're in a relationship and then you're concerned about how you're not able to kind of commit to the intimacy or partake or want to, that libido is low, and that's having an impact. I think part of it is acknowledging it and talking about it with your partner, having that conversation about, hey, listen, let me explain to you what's going on with my body. And I highly recommend talking to a provider that's specialized in menopause, because they can speak to you about this, explain it even better for yourself. And if you want to bring your partner into that conversation, bring them in, have them learn and hear what's going on to figure out what's changed. How do we do things differently? Maybe what worked for the last 20 years isn't going to work anymore. Let's mix it up a little bit, right? It can also be a time to have fun and explore a little bit from that perspective.
I love that.
Also, yeah, exactly, right? Like have a little fun with it. And
So
then also for women that aren't in a relationship but are looking to be active, again, they should feel like they have that, kind of confidence and understanding of their body to be open about what it is that works for them. Maybe do a little self-exploration to figure it out. What's changed? What works now? And be able to kind of guide someone through that.
And what are some ways we could have fun?
So this is where I get to talk about one of my favorite things. I'm actually a medical advisor for Playground, which is a sexual wellness company. And I got involved with them because of their focus on products that are really geared towards us being able to have fun, us being able to really kind of take ownership in the bedroom with intimacy and really say, you know what, I want to be use things that are fun for me and that are comfortable for me and that aren't going to mess with my pH and aren't going to, set my, make me feel uncomfortable afterwards. Right. So it's about like lubricants, or whether it might be intimacy oils, different products that are available now. But a company like Playground, what I really appreciated about them was that they designed these things with the female anatomy in mind, right? It was really about how do we take care of our biome, our vaginas, our vulvas. Like, so from that perspective, really focusing on that. So some of it is, like I said, self-exploration, being able to have a lubricant, and whether it's with yourself or with using a sex toy or with your partner, trying to figure out what's different, what sets the arousal process going may have changed a little bit as the anatomy changes too. But again, the biggest thing for me to kind of impart to my patients is it shouldn't be painful. It should never be painful. You cannot push through pain. So you really do have to make it comfortable, and it has to feel pleasant to even from the very start. So using a lubricant and being committed to that, not feeling like a lubricant means you're broken or something is wrong and it's like a negative connotation. It shouldn't have that. It should be part of the fun of it. So kind of using those kinds of, aspects.
So helping us just relax into the flow and
Yeah.
connection. And something I want to bring to the table, and this might just be my experience, being career women, and well, not just career women, but us women are doers,
Yeah.
and which puts us in our masculine energy often, which is not a bad thing. Our masculine energy helps us do. And so I've been learning that it's such a beautiful energy to fall into our feminine. However, I have a challenging time falling into my feminine. Not that I'm not kind or loving, but energetically, because I'm a doer, I feel like I'm constantly in that masculine energy, and I want to fall into that feminine energy that's fun and playful, like you're talking about. But sometimes I have a hard time. Like,
Right.
what's one way, us women can maybe shift from our masculine doing energy into our feminine flow, playful energy?
And that's where I was talking about really kind of creating that time and space. So, whatever it might be, put it in your planner if it needs to be a doer type of thing, that you
Mm,
set aside time for yourself. Thursday night is girls' night. And that means it's for you, whatever that means. It might be a bubble bath. It might be, reading a good book, by yourself comfortably somewhere where you just get to experience you in your body and in your space, right? You're not worried about the to-do list and all the things that you manage and run and, make happen in your life and everyone's life around you. And then when it is with firm and intimacy standpoint, same thing, whether it's for yourself or with your partner, taking some time aside and saying, we're going to focus on this. This is important to me too. Let's make it fun. Let's do something different. Let's spice it up a little bit, maybe doing something different than you typically did, just to kind of reignite some of that fun. So I think it's about creating that, right?
You mean we don't just get to walk through the door anymore and want to tear each other's clothes off?
Not necessarily, unfortunately. I
Oh, well,
mean,
damn those movies. Damn those movies.
exactly.
So, which brings me, and I think I think there's a fantasy around, intimacy where again we're just expected to be on, and you
Mm,
just walk on through the door and the desire is supposed to be there, and it's just that's I don't believe that's reality in long-term committed relationships.
that's true. I think it ebbs and flows, right?
Mhm.
And if you are and happily in a long-term committed relationship, which is a wonderful thing, there's always going to be peaks and troughs to that, whether it's because of stresses in life, whether it's because of family or careers or financials, whatever. There's always going to be stressors that kind of put each person potentially on a different wavelength when that comes. But again, if you can be more open and connected about it, then you're able to sort of navigate that a little better. Maybe you need a little more care or a little more time or attention. Maybe he does or she does, right? Maybe your partner does. And that might be where you need to kind of help them figure out what it is that they need to bring that, intimacy back to the relationship. So I think a lot of that is sort of figuring out what works between two people, to kind of keep that flow going. But no, it's not always going to necessarily be, let's go like anywhere, get the, the airplane and the bathroom at the restaurant, nothing crazy necessarily, but it could
The
just
ho
be you get to do something fun again, or have a romantic dinner, or you give each other a massage. I mean, it could just be taking time to do something like that.
Mhm. And I agree. And so what I've heard the theme is communication,
Mhm.
communicate, to also take time for yourself,
Yeah.
and then again connect. Just communicate, connect, take time for yourself, which again it isn't always easy, especially when we're so busy. So would you recommend start planning for perimenopause and menopause when you're like 20?
Just know that it's coming. Enjoy your time. Obviously, live in the moment, right? Like enjoy your lives. But I would say that know that that's what happens, and it doesn't. Again, it's not the end. It's just
No.
we learn to navigate it. And again, if you're paying attention to your body and what's going on, you're going to be mindful of that too, and be ready to kind of approach these things. Take care of yourself. Go see your physician. Talk to your OBGYNs about this. Don't take no for an answer. Like
Yes.
it isn't just a just grin, just bear with it. Oh, it's your lot in life. Hey, this is just comes with the age. It'll end eventually. No, you don't
Thank you.
have to suffer through it. There
Thank
are
you.
ways that you can really pay attention to it and like attend to it.
Thank you. Thank you so much for that. Because you're right. We don't just have to grin and bear it. And there are so many different things we can do. I know you talked about options
Mhm.
earlier, and I know that there are natural hormones, there are, synthetic hormones, and there's women that choose to do it naturally. Is there something that you recommend, or is it really individual to each person?
It's very individual. I find that you have to be comfortable with the decision you're making, what you want to, take part in. So if it's something that, and I really want to go the natural route, I really would love to avoid anything hormonal. And there could be lots of reasons about that. My role is to educate and make sure people understand the safety of hormones, because there's been a lot of negative connotation over the years about hormone therapy. So having them understand that, listen, it's a safe option, potentially a safe option, depending on their risk factors. And if we've considered all that and that's on the table, that's on the table, as well as other things. So we could start with supplements. We could start with acupuncture, mindfulness, all these different things that you could do right off the bat. There's nothing wrong with any of those things, but some women need more. It doesn't get them far enough, or it doesn't help much at all. And so that's where what other options are there? And there are prescription hormonal and non-hormonal options available,
Okay, good
right?
to know.
So there are non-hormonal options prescription level available, but you have to be able to talk to your provider about that. They have to be able to educate you about that. It shouldn't be a closed door. It shouldn't be, nope, there's nothing, right?
Mhm.
It's there's tons. There's a lot.
I definitely appreciate that. And so, how do you feel about combining, the Western medicine with maybe the holistic approach with
I'm
some?
I'm a yeah, I'm a fan of it. I actually tell people, do both or start with one, and then you could always transition to the other. See what works for you, find out what works for your body. Supplements are difficult because there's not a ton of good uniform data on it. Like there's not a lot of good studies, especially a lot of Eastern medicine and holistic kind of options. There's not a ton of scientific data that we are sort of used to receiving and interpreting, right? So some of it is a little bit of trial and error. We know some of the things that have, maybe middle of the road, or some people anecdotally have said that it helps. And I love giving those as options. Take some time to work, may take, several weeks, even a couple of months to know if it's going to be an effective treatment. And for some women, that's all they need. And that's perfectly fine. But if that's not what's working, or if your symptoms are quite debilitating and it's really affecting your quality of life, and you really need some help, it's affecting your relationships, how you function at work, etc., your sleep, oh my gosh, you may want to consider something a little more well studied, and we have data for it and we know it's going to work. And let's start there and maybe get some stuff under control, and then kind of revisit, okay, do we need to stay on this course of therapy for very long, or is it just to get over the worst of it? There's a lot of things to talk about there. There's a way to blend all of these things, so again, individualize the treatment based on what's important.
And I appreciate you for all of this, because as I was going through my own journey, I didn't find someone like you to to connect with. Eventually, I was led to someone, and it was helpful, but it wasn't an easy find. So I appreciate you being here and just sharing and letting us know that we're not crazy. The struggle is real. Our hormones change, our metabolism changes, and we have to do these things. But also, it's a great season of life, like you said. It's a time where, for many of us, our children are grown and we're feeling good. And so it's like I said, it's our 50s are our new 30s. especially with all the research, with all the, education and research, we can make it a really great time in our lives.
Absolutely. And as you mentioned about finding a provider who's sensitive to this, I typically tell people to look at the Menopause Society, which is
Mhm.
menopause.org. It was
Okay.
the North American Menopause Society. It's an official medical organization of providers, doctors, nurse practitioners, nurses interested specifically in menopause. And they
Mhm.
actually have a database where you can search by zip code, state, whatever works, to find certified menopause practitioners. And that's a true certification. It takes writing an exam to
Wow.
be able to become certified. And then once you're certified, you have to maintain it by doing ongoing education or repeating the exam. So it's no joke. Like you have to keep it up every 2 years. So I highly recommend checking that out because that's going to be providers that are interested in this. They're taking the time to keep up with this. What's the latest and the greatest available.
Mhm.
So personally, I think that's a great resource.
No, thank you. I've never heard of them. I've never
Mhm.
heard of. And so what does life look like in menopause? Because I always thought menopause was like the perimenopause stage. And then I learned that it's not. It's, after you've, stopped your cycle. And so
Yes.
now for myself, I'm like, what does it look like? I mean,
Right.
I'm going through it, but what is it like? I don't know what to expect now that I'm here.
Right. So for some women, some of those symptoms that we talked about, the hot flashes, night sweats, etc., still do extend kind of into past that 1 year of no period. And they may have it up to like maybe 3-4 years afterwards, even.
Mhm.
Um, and so again, the intensity of it might vary. How again, which symptoms are more prevalent might change. For some women, it's the hot flashes and night sweats that come up first, and then later on, it's more of the vaginal dryness and pain with intercourse. Um, and then once you kind of settle into it, many women, it will eventually subside and these symptoms will be less and less noticeable. They may notice that it flares with stress. So
Mhm.
life stressors, when you're going through something particularly health wise or someone, that you're dealing with something stressful in your life, you may notice, gosh, those hot flashes started climbing up again, I'm starting experiencing those, or the night sweats waking me up in the middle of the night. And that's because, again, our body is responding to the stress, and that might be
Got it.
part of it. So just
Okay,
being,
that's
again, mindful of that and knowing, hey, that's what it is, doing a sort of a self-check. Why is this going on?
that's good to know. And then what about our libido? What libido? What about our libido? Like, I know we talked about making space and being with ourselves and communicating, but is there, like the playground has the lubricant? Is there
Mhm.
something that would help our libido kind of get a zippy?
Yeah, actually, so some of the ingredients that they use are actually sort of known to do that. So, for example, we just launched an intimacy oil that can be used for
Mhm.
massage or for intercourse or even as a lubricant.
Mhm.
That includes components like ashwagandha and other herbals and supplements that are sort of known to help evoke some of those, feelings of relaxation. And you need relaxation in order to have sort of that decreased inhibition that leads to arousal and being able to enjoy intimacy. So some of those things are helpful.
Okay.
And so, finding kind of the tools that you need to kind of get there are helpful.
Okay. So you mentioned ashwagandha, so that's a good one.
That is a
Okay.
good one.
Good. So what inspired you to become a surgeon, OBGYN, menopause specialist? I mean, you're brilliant. I mean, what inspired you to take this route?
Oh gosh, I mean, it was a very interesting path. I mean, it just felt like the universe opened doors in certain ways that I ended up here. I went to med school thinking I wanted to be a pediatrician, and then I did my pediatrics rotation 3 years into med school and realized I don't like this. And I really loved being hands-on, and I loved surgery, and I loved OBGYN. And then I went the OBGYN route because I really liked taking care of women. I liked that, women do so much for others. And so wanting to do more for them and really getting them in their best health so they can get back to kind of everything they wanted to do was really important to me. And then my path circled back during residency when I was doing the training and many hours a week, nights spent in the hospital delivering babies, all these things. The thing that really captured my attention again was surgery. And so, and really minimally invasive surgery, so robotic surgery, laparoscopic surgery, because I just thought it was fascinating that you could do such complex procedures through these tiny incisions, and the patient could go home the same day. She could be back to her life within a few days, back to work within a couple of weeks, and just take care of herself. I mean, how many people put surgery or that kind of self-care off because they don't want to take the time off? They can't do it, right? So
Yeah.
knowing that you could do that was like incredible. And so then I did some extra training in that. And that also opened up a world of the gynecology side, right? OBGYN is obstetrics and gynecology. Obstetrics is all the, pregnancy related care. Gynecology is everything else. And we really don't spend a lot of time in general residency training on the everything else because you're doing so much of the obstetrics. And so when I went down that surgical training route, I was able to work with mentors that this is what they did. They took care of chronic pelvic pain and endometriosis and menopause and sexual function, and being able to talk about these things was, I just thought it was fascinating and so much fun and, engaging.
And I appreciate that, again, because those are not subjects we typically talk about. We're embarrassed to talk about it, or it's taboo. And so I appreciate the different people that are coming forward to say, let's talk about menopause, let's talk about intimacy, let's talk about sex, because those are not things that we talk about in a healthy way.
Yeah, exactly.
Right. So what has been one of your greatest challenges during your career, and how did you overcome it? And did it end up being a blessing?
That's a great question. Greatest challenges. Yeah, I mean, yes, it did end up being a blessing. So, in my career path, I made certain decisions that led me down a path where I thought I would be in a certain type of practice, working with a certain population, et cetera. And it didn't quite work out that way. A lot of things happened as far as, personalities and sort of visions of the future and kind of how were supposed to come together. And it ended up with me taking a different path, making a different decision about how my practice would go forward. And it ended up being like an incredible blessing. It happened during COVID, and it allowed me some security there. It allowed me some time. I had my third child during that whole, kind of uncertainty, but having that change in my career path, that fork in the road, actually allowed a lot more support. And it was better for my mental health from that perspective too. And my family health as well. So from those perspectives, and then I've been able to have unexpectedly, a lot more autonomy on how I, kind of shape my career and how much I work and how I balance what I want to do as far as surgery versus, office patients. And it actually ended up being a really good thing. Yeah. In the moment, it was, pretty disappointing and really challenging. And we were, a lot was tied into that initial kind of idea, and the fact that diverged ended up being kind of the best thing for us, all of us. Yeah.
Sometimes it feels good to be your own boss.
Yeah. And, it's a little bit about being one's own boss, knowing where you want how you get the support that you want. And then really kind of figuring out, is this how you can potentially structure your career and having that balance for yourself. So it's been, and also offers me time to do stuff like this, which I love. So
yeah. With you, and I appreciate it because I know how busy you are. So what's your vision over the next 5 years?
So it's really kind of fine-tuning my practice to really be about that complex surgery, something that I feel like I have a skill set to offer that's different than, others even in this area. And so, really kind of building that up, calling attention to it, educating around that, so we can kind of really make that like a strong part, because I love doing surgery. I love, being able to do that with my hands. Again, coming back to that, what brought me to this, right? And then that other side of gynecology, like that's the flip side of the coin. That's how I want to spend the rest of my time, talking about all those things that I love. And really that's what I want to make my practice. And, being able to balance that plus everything else, right? Like family and kids, and I love to travel, and my husband and I like to get away together, and travel the world. And so finding time for all of those balances in the next 5 years in a way that allows me to kind of check all those boxes, those things that make me happy.
And that's what it is at the end of the day, for us to find our joy.
Yeah,
And
absolutely.
that's how we serve too. Thank you so much for joining me today. I appreciate you and all of the information and vulnerability that you offered, because I know it's not an easy subject to talk about. If there's one last thing you can leave us with, what is it?
Take care of yourself.
Yes.
Really pay attention to yourself. Take care of yourself. You are important. Everyone leans on you, and you take care of everyone else in your sphere. And many times you have to just take a step back and focus inward.
That's right. Thank you. And I appreciate that. And also, can you let us know where we can find you and the playground products for those that are listening more interested?
Sure. So helloplayground.com. If you go to their website, there is office hours with Dr. Shyama, where we'll be answering questions from anyone, clients that are interested in anything related to sexual function, and also potentially putting up some videos and having kind of different chats there as well. Through Playground, I'm also doing a lot of guest speaking, so that's involved there as well. They'll give you links as to where you can see more information on this topic. My website is drmatthewsgyn.com, and so I try to put up more up-to-date information about these different topics there as well, and then also my Instagram as well as drmatthewsgyn.
And we will share that as soon as the episode is uploaded, and all of the information will be there for our listeners and our audience to connect with you, because I think you're amazing and we appreciate you. And for all of you watching together with us today live and on the replay, I appreciate you and I'm very grateful for you. And if you have any questions for myself or Dr. Shyama, please don't hesitate to reach out. Even on the replay, we will definitely come back to your questions. Until next time, I wish you an incredible day ahead, evening, night, and thank you so much for listening. And hang on with me, Dr. Shyama.
Sure. Thank you, Grace.
You're welcome.